There are lots of conditions that we use ketamine to treat. CRPS, chronic migraines, fibromyalgia. We treat a lot of peripheral nerve pains, a lot of different pain syndromes that we treat quite effectively. There's a few ways that we find ketamine very helpful for pain. One, we feel like that the ketamine sort of coats the nerve endings, right? So that's the first kind of critical piece for ketamine pain management. There's a couple other things that we feel like ketamine does and that research has kind of shown us. One is, the second one is that ketamine does attach to the kappa and the mu receptors, which are narcotic receptors. Those are the opioid receptors that opioids attach to. And although ketamine is a non-opioid, it does have that effect on the opioid receptors, which is the second method in which ketamine provides pain relief. And then the third, and one of the more important ones, as well as how does it help pain, but how does it also help mood disorders, is through a process called neuroplasticity. And this is where by going through the ketamine treatments and having that dissociative or that sort of psychedelic experience, we find that patients get a fair amount of what's called neuroplasticity. And so that's either a repair of a patient's synapses or just basically creation of new neural pathways, which can be seen in MRI, on an MRI. If you do an MRI with contrast on a patient before and after ketamine, kind of the global connectivity of the brain, it's just unmatched. The post-ketamine, the post-treatment patients are going to be, they're going to really light that MRI screen up because the connectivity is going to be so much greater. And so for those reasons, not only are you getting changes in your brain, but the brain is now changed in the way that it manages pain signals. So through kind of coating the nerves, sort of attaching to the mu and the kappa receptors, the opioid receptors, and then the neuroplasticity, ketamine is a phenomenal pain management tool, and we use it daily very safely and effectively for our chronic pain patients. So that's a great question. How does ketamine relieve depression? And so ketamine works on depression the same way it works on PTSD and also anxiety. So there are a couple of ways that ketamine works. Kind of one of the older, more well-known methods by which ketamine works is NMDA receptor antagonism, right? So ketamine antagonizes the NMDA receptor, which allows kind of for more free-floating glutamate. Right, because ketamine does cross the blood-brain barrier, and so by blocking those receptors and not allowing glutamate to bind, it allows for more free-floating glutamate. And then kind of the second way that ketamine works is kind of, we touched on this in the how does ketamine affect pain, is through neuroplasticity. So through the use of psychedelics such as ketamine and others, one of the processes that we see patients actually have physical changes to their brain, good positive changes, nothing that's dangerous. These changes come about through either seeing those synapses which have been damaged by stress or abuse or trauma. It undergoes some reparations, thereby opening up some pathways that maybe the patient had but haven't been using effectively, or just the kind of the creation of new neural pathways. And then through those neural pathways, patients just process information so much cleaner and so much more efficiently. This can be viewed also on MRI. If you do an MRI of a patient's brain before and after ketamine treatment, significantly more lit up under MRI, which proves that that neuroplasticity has occurred and that the global connectivity for patients is just so much greater. And so through those new pathways, it just changes and modulates these mood disorders. Also with the increase in free-floating glutamate is a great indicator of how ketamine helps with depression, anxiety, and PTSD.